Well, staying on the issues of masks, perhaps we should revisit the importance of masks for the sake of KwaZulu-Natal's Health MEC, Nomagugu Simelane. Well, Dr. Kerrin Begg is a public health medicine specialist and joins us now to rediscuss the importance of masks. Dr. Begg, a very good afternoon. I keep saying good morning. Good afternoon to you. Are we really seriously having to remind people to wear masks? Are people tired of wearing masks? Is there mask fatigue, so to speak?
Yeah, I think that you're right, that is one of the extreme challenges, but it really is something that we need to be really vigilant about, because it's so easy to do and really costs us so little but protects others. And I think one of the mantras we've forgotten is that my mask protects you and your mask protects me. So, it's not just about me, myself, and I. It's our concept of protecting those around us and making sure that we don't infect anybody else. So the reason for masks is that it reduces the potential dose that we might project onto others. So if we are asymptomatic and carrying the SARS-CoV-2 virus, then so we don't know, or we're in the early stages and don't yet know, it means that we are keeping our respiratory secretions to ourselves and not distributing those. So the whole thing around COVID and SARS-CoV-2 is around the 3 Ds: dose, dispersion, and distance. And remember that the further away we are from people, so even more than 1.5 meters if we can, is that the droplets spread when we sneeze or cough or breathe or sing. And so the further away we are from people, the better, the lower the risk. The same comes for dispersion, that if we have high ventilation and the drops that are suspended in the air can be blown away, then the lower the risk for transmission. And then similarly, if we wear a mask, that we then reduce the risk of transmission, because we are the dose that then comes to the other person is then so much lower. So I think the concern around parties, and certainly as we come up towards the end of the year, for matriculants, for end-of-year parties, for birthdays, people feeling fatigued and frustrated at being constrained, is that we really need to be focusing on reducing risk. And so we need to be distant from each other. So that's why parties, indoors in particular, are problematic. We need to be avoiding the 3 Cs, avoiding crowded places, closed spaces, and also close contact. So touching people is a problem. So there were lots of things problematic around a party like that. Yes. Hugging and kissing is problematic. Being in close contact with each other is problematic. Being in a closed environment is problematic, and then not wearing masks is problematic. So all of that would have made that environment a high risk for transmission of COVID.
Okay, Dr. Begg, very quickly, when is it imperative that you wear a mask? Remember that people go to work, they wear a mask, they go to school, they wear a mask, they get home, it's the first thing they rip off, but they are still in the company of other people at home. Where is it imperative? People go to gym, people do a whole lot of activities, they go shopping and so forth, they are in the car. So is it 24/7 or what is the situation? Just to remind, our viewers on ENCA, not to take this lightly.
So remember that it's about understanding the possibility of you transmitting the virus to anybody else. So if you are at home and in your biobubble, and so these are the people that you're with all the time, you're all monitoring each other's symptoms, and you're aware, and that you all hunker down as soon as any member of the biobubble becomes symptomatic, until you're aware of what the status is. And so you all quarantine until further notice. Then it's probably fine to be at home without wearing masks. But clearly, as soon as somebody's symptomatic, that person needs to isolate so that others don't have the possibility of catching the virus, and then everybody else needs to quarantine. And so the only time that it's really necessary to wear masks at home is when somebody has become symptomatic, and then all of you should be wearing masks to prevent transmission between each other, but also doing all the other things, which is physical distancing and stopping any close contact. And then when you're in the outdoors, so if you're hiking up a mountain, there's nobody else around, then, you may well drop your mask for a period of time, because there's no risk of transmission. But as soon as somebody else comes past, or you see somebody coming in the distance, then it is appropriate to put your mask back on to make sure that in passing,
very important and wise information there, Dr. Begg, that I believe we really should keep reminding people for as long as COVID-19 is there. I'd like to thank you just at that point as we have to wrap up. That's Dr. Kerrin Begg, who is a public health medicine specialist. And of course, just reminding us that despite us being very tired of wearing the mask and it being uncomfortable, it is saving our lives and those around us as well. So, still to come.